Hi, Dr. Blake here, and Leonidas, and we're going to show you how to do hydrotherapy. This is one of my favorite treatment modalities for acute injuries and pain and even chronic pain a lot of times. So the main thing that we're doing with this therapy is we're moving new, fresh blood into the area, and we're moving lymph and dead cells, cellular debris, all that stuff out. That helps with pain right in the moment, but long term it will help to heal an area because you're bringing the new blood in there and moving circulation through, which is carrying all of the nutrients and immune cells and etc. to heal. And this is so easy that a 2-year-old can do it. So the two things to understand that we're trying to accomplish here is the blood flow and the lymph flow out. So that's going to look like essentially we're making the area of our body red. It's easiest if you have a local area to do this. If you have systemic pain issues like fibromyalgia, this may be helpful, but there would be a different way I would approach it than in a localized area like this. So we're going to start with hot water. You ready, Leo?
Yeah.
Okay, so point it down this way. Here we go. So, pointed at my knee. So, 3 minutes for hot. You can see the color of my skin right now, and you're going to see after we do this protocol, it's going to be quite red. This is going to be good for pain in the moment and stiffness as well. We're going to do about 3 minutes of hot, and then we're going to do about 30 seconds or maybe a minute of cold. So when you do the cold, it purges the tissues in the area, okay? So the hot water brings some blood there. Okay, point right there, bud. There you go. Hot water brings blood to the area, and then the cold purges the tissues out, the vessels contract, but then they quickly open back up again and bring more blood, because when the body feels the sensation of being cold, it says, I need to warm that up, and sends blood there. But we don't do the cold for too long because we don't want to have the effect of closing all the vessels down like if you put ice or something on somewhere. So it's getting red right now from the hot water. The reason I'm doing my knee is because I actually did tweak my knee yesterday, and this one's a little bit swollen, so this is going to probably help the swelling. I'm going to do this a couple of times today, and then it's going to make it feel less stiff and painful right away when I'm done. You're going to do that hot-cold back and forth 3 times, okay? So we'll do cold now. And Leonidas always checks to see if it's getting cold. Yep, it's cold. I can feel it. Is it cold yet?
Yeah.
Yeah, okay. So we'll point it right at my knee. There we go. So the painful part of that I'm having is my meniscus down here. And so we're mainly pointing the water right at that, but we could go all the way up to here if we wanted. We could get the whole area red and bring blood flow. And the lymph vessels actually at the knee are in the back of the knee. So we can kind of focus a little bit on those areas. If you know about the lymph flow, I mean, it's pretty simple. It's kind of like the veins go back to the heart. The lymph basically goes along those same pathways. So everything's coming back to the center. So it comes at the back of the knee, and then, in the groin, at the foot, they come through this way and up the back. So you can kind of do the cold water. Okay, we're going to switch back to hot. You can kind of do the cold water all along that lymph area if you want. Most of the lymph is also right under the skin, so we could be doing the cold all along my upper leg if we wanted to, and it would help move some of that lymph out, open up the channels above. Yep. Right there, bud. Thank you.
Papa, hope,
Mm-hmm.
hope, hope.
You're helping?
Yeah.
Do you know what kind of medicine this is called, Leo?
Ow.
It's for owls, yeah. Water medicine? Hydrotherapy?
Yeah.
I love hydrotherapy because it's cheap. I mean, it's essentially free. Like you can do just cold hydrotherapy measures in cold water, like in a river, and that's free. And it doesn't take very much water to do this. That you can do this with even less water if you have like a foot or a hand, and you can just have buckets filled. Right up here on my knee, bud. There we go. Gonna get my foot too. Okay, back up here. This is where it. There we go. That's where it hurts. So we're gonna just shorten it up just a little bit since we're kind of showing you all how we do this. So you can see that it's getting pretty red, and the cold really brings a lot of blood there. I mean, it'll just get pretty red. Like I don't have really as cold of water as I would like. So when you're doing this hydrotherapy, know that the bigger the difference in temperature of the water, the stronger of an effect you're going to have. If I had a little bit colder water, it would get even redder, but this is what I have. It's the easiest for this part of my body. It's a really interesting feeling, though, if you do this on an extremity, to feel when you go to the cold, the sensation. I mean, you can almost feel everything initially squeezing tight, and it's almost tingly in a way, and then it opens up and it feels really relaxing. So we're going to go back to hot. This is the third time. Is it getting hot? Yep, okay. Pointed at my knee. Thank you. There we go. So you always end on cold with hydrotherapy, because that does the last purging and bringing blood there. So the rule is you do 3 times and then end on cold always. Now if you're doing this in, point it right there, bud. Thanks. If you're doing this in a cold body of water and you don't have warm water around, the cold's really where the medicine's at, because you're getting the purging sensation, but your body also brings blood there. So if you're like by a cold river or something and you're doing this to like an ankle or a foot or something, you put the extremity in the water and get it cold, and you want your body to be able to adapt. You don't want to keep it in there so long that it feels like it's going numb. You just want to, again, like 30 seconds or so and maybe a minute, and you want to leave it in the cold long enough that you can take it out of the water, and then your body is able to adapt and warm it up and bring blood there. So you would just wait, instead of having the hot water that you wouldn't have like by a river, you would just wait for your body to really warm it up nicely and then dunk it back in again. And this is great if you're doing a hike. If you go on a hike, and even to just help your feet feel better at the end of the day, awesome thing to do. And we're going to go cold. And that is all there is to the hydrotherapy regimen that Leonidas and I wanted to show you. You can see how red that spot's getting. It feels really good and loose right now. We'll see when I get up and walk how I feel. Anything you want to say, Leonidas? Anything you want to tell people we're teaching?
Water.
Okay, water medicine.